So today we're talking about something that affects millions of people around the world, yet still causes a lot of confusion, and that's statin side effects. If you or someone close to you has been prescribed Atorvastatin, Simvastatin, or Rosuvastatin, then you've probably heard mixed opinions. Some people swear by statins for keeping their cholesterol in check, while others complain about fatigue, memory issues, or muscle pain. In this lesson, we're going to explore both the common and the rare side effects of statins, why they happen, what they feel like, and what to look out for. And if you're a student, I'll throw in a few easy ways to remember the key points for your exams. If you're a patient, this will help you stay informed and know when to reach out to your doctor. All right, so let's start with the basics. Statins are a class of drugs that lower cholesterol, specifically LDL cholesterol, the one we usually call bad cholesterol. Lowering LDL helps reduce your risk of heart attacks, strokes, and other heart-related issues. Now, the most common ones you'll hear about are Atorvastatin, which is also called Lipitor, Simvastatin, which goes by Zocor, and Rosuvastatin, also known as Crestor. There are others too, like Pravastatin and Lovastatin, but Atorvastatin and Rosuvastatin are definitely the most prescribed. So, how do they work? Let's keep it simple. Your liver makes cholesterol using an enzyme called HMG-CoA reductase. Statins block this enzyme, and when that enzyme is blocked, cholesterol production goes down. Instead of thinking of it like a sponge soaking up cholesterol, think of it like turning off a faucet that fills the cholesterol tank in your liver. Once that faucet is off, the cholesterol levels in your bloodstream start to drop. Okay, cool, but like with every medication, there's a catch. Statins can come with side effects. Now here's something important. Most people do totally fine on statins. Like really, the majority have no serious issues at all. But for those who do experience symptoms, it's good to know what's going on and why. Let's start with one that's surprisingly common. Headaches. Yep, statins can cause headaches in some people. These can feel like dull, tension-type headaches. Or in a few cases, they can make existing migraines worse. Now here's the weird twist. Some research shows that statins might actually help reduce migraine severity, especially if they're taken alongside vitamin D. So yeah, in some people, statins cause headaches, but in others, they might actually help. Honestly, we're still figuring out why. It probably has something to do with how statins affect blood vessels and inflammation. If you're studying for exams, by the way, here's a fun one. Statins and headaches are a great example of a paradoxical side effect, meaning it can go either way. Okay, moving on. Let's talk about memory and brain fog. Some people report feeling forgetful or like they're just not as sharp mentally when they're on statins. It's not super common, but it definitely happens. And when it does, it can be kind of unsettling. Now, the good news is this usually goes away if you stop the medication or switch to a different one. There's no strong evidence that statins cause permanent memory loss. But if you or someone you know starts having brain fog or forgetfulness, it's worth mentioning to the doctor. A quick way to remember it? Think. Statins might fog the state of mind. All right, now let's talk about the one side effect everybody's heard of, muscle pain. This one is big. In medical terms, we call it myalgia, which just means muscle pain, and myopathy, which means muscle damage or weakness. Some people describe it as a soreness or ache, especially in the thighs, shoulders, or lower back. Usually it's mild, but in very rare cases, it can turn into something more serious, called rhabdomyolysis. Now, rhabdomyolysis is when muscle fibers actually break down and release proteins like myoglobin into your blood. That can overload your kidneys and lead to real damage if it's not caught early. But just to be clear, this is very rare. Like, really rare. Still, if someone starts a statin and suddenly feels severe muscle pain, they should definitely talk to their doctor. Most of the time, it's nothing serious, but better safe than sorry. Oh, and just so you know, certain people are more at risk for muscle side effects. That includes older adults, people with kidney or liver disease, heavy drinkers, folks with low thyroid levels, or people taking other cholesterol medications at the same time. If you're trying to remember this for a test, here's a helpful phrase. My statin muscles might rage. That gets you myalgia, statins, muscle pain, myopathy, and rhabdomyolysis. By the way, if you're finding this video helpful so far, or if you're learning something new, go ahead and hit that like button. And if you want more content like this, explained clearly and backed by science, make sure to subscribe to the channel. It really helps out, and I'd love to have you along for more lessons. Let's keep going. Another side effect that's been getting attention is blood sugar changes. Some statins can slightly raise your blood glucose levels. It's not dramatic. But in people who are already borderline diabetic, it might push them into the type 2 diabetes range. Now, does this mean statins cause diabetes? Not really, but they can contribute to insulin resistance in some people. Most doctors still recommend statins for people with diabetes because the heart protection they offer usually outweighs the small increase in blood sugar. But yeah, it's something to keep an eye on. Here's a little memory tip. Statins can cause a sugar spike. Okay, next up, liver effects. Statins are metabolized in the liver, so some people can develop elevated liver enzymes. Most of the time, you won't feel anything. It just shows up on a blood test. But in rare cases, it can lead to actual liver inflammation or hepatitis. If that happens, you might get symptoms like pain in the upper right part of your belly, nausea, maybe yellowing of the skin or eyes. That's jaundice. This is why doctors often check your liver function before you start a statin, and again, a few weeks later. For students, statins stress the liver. Simple and easy to remember. Let's talk sleep. Some statins, especially Simvastatin and Atorvastatin, are more fat-soluble. That means they can cross the blood-brain barrier more easily, and that might mess with your sleep. People have reported insomnia, restlessness, or weird dreams. It's not super common, but if it happens, it's worth switching to a different statin, like Atorvastatin or Rosuvastatin, which are more water-soluble and less likely to enter the brain. And yeah, some people on statins just feel tired. Fatigue is one of those vague side effects. It could be from muscle weakness or maybe changes in energy metabolism. Either way, it's something patients notice. Let's move to something kind of unexpected, bowel changes. Some statin users get constipation, others get diarrhea, some bounce between the two. The weird part is, even people taking placebos in trials report these symptoms. So it's hard to say for sure if statins are the cause. But if someone notices it soon after starting a statin, it might be related. Okay, here's one that almost never comes up, but patients do mention it sometimes. Hair loss. Yep, statins have been linked to thinning hair or increased shedding. It's very rare, probably less than 1%, but still something people notice. No one's exactly sure why it happens. Could be hormonal, could be nutritional, but in most cases it's mild and reversible. Oh, and one more rare but serious issue, thrombocytopenia. This is a drop in platelet count. There have been a few case reports, mostly with Atorvastatin, where platelet levels dropped really low. If someone starts bruising easily or bleeding more than usual, it's worth checking their counts. All right, I know that was a lot, so let's do a quick recap. The most common side effects are muscle pain, headaches, and fatigue. Less common ones include blood sugar changes, memory fog, sleep issues, liver enzyme changes, and digestive issues. Rare ones? Hair loss, thrombocytopenia, and rhabdomyolysis. If you're a student, try this. My head feels foggy, muscles tired, sugar up, liver mad, sleep light. That covers memory, headache, fatigue, blood sugar, liver, and sleep disturbances. So what should you do if you notice any of these? Please don't stop your medication on your own. Talk to your doctor. Most of the time, they can either reduce the dose or switch you to a different statin that your body tolerates better. At the end of the day, statins are incredibly effective at reducing heart attacks and strokes. And for most people, the benefits far outweigh the risks. But hey, being informed means you can keep an eye on your body and speak up early if something doesn't feel right. Thanks for sticking around. If you're studying for an exam, I hope those tips helped. And if you're a patient, feel free to drop a comment and share your experience. Your story might help someone else. Don't forget to like, subscribe, and check out my other videos if you want to learn more about medications and how they work. All right, see you next time.